Hello, I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Myths. And today we're going to talk about the latest findings on COVID infection mortality rates. I could not have stressed this more all along this process that while case fatality rates, which is the number of deaths based on people we know have COVID, are what we use at the beginning of something when we don't understand how many people are infected but aren't diagnosed. So early in the game of SARS-CoV-2 or COVID-19, we really didn't know how many people were infected or exposed, and the people who were sicker were more likely to be tested and test positive. So those initial numbers of case fatality rates were scary. And those are the numbers that we threw out. And I think for some reason, like, people still hang on to those numbers and think that COVID is this death trap waiting to happen. And yet, as we've had time to kind of settle in and some of us have calmed down, we can see that the numbers aren't nearly as scary as what we initially envisioned. And part of that is because we started to realize that a huge chunk of the population who gets exposed to COVID remains asymptomatic. So that is something called infection mortality rates or infection fatality rates, meaning how many people are dying out of the entire umbrella of people who have been actually have the virus, whether identified or not. We have to make estimates of those based on antibodies or based on other numbers from other areas. But those infection fatality rates gives us a much better idea of what we're looking at. And this late in the game, we should not be talking about case fatality rates. We still do, but it is inappropriate months later to still be referring to case fatality rates. And those numbers, if they're being used, are generally designed to scare, not to educate. So this particular study came out of Indiana. And one of the things that was interesting is they eliminated institutionalized people. So that means people who were in prison, people who were in nursing homes, because in Indiana, almost, was it 55% of the deaths were in nursing homes. So we needed to kind of take that out of the equation to get a better idea of how many people in the community are at risk of dying from COVID. One of the things I have to throw out here is that there's an entire another category of exposed but not infected. And I've certainly covered these in prior videos. And this has to do with that family of 5 where only one person tests positive, but there's no way everybody else wasn't exposed. So if you really want to get an idea of the overall burden, you really have to take into account those people. We don't, because that would be a daunting task. But the reality is, if we looked at exposed but not infected, asymptomatic people and infected people, the numbers we look at would probably go down quite a bit. We know that in households at the high end, 20% of people are infected. That could mean that for every one person infected, another 5 were exposed but not infected. Again, we don't do that, but it kind of puts things in, or should be used to put things in perspective. So when they looked at the number, the infection fatality rates in Indiana in people 12 and older, they found that the death rate so overall, big picture, when you include all age groups, it's 0.26%. Now keep in mind, when we talked about case fatality rates, they were throwing out numbers as high as 10%, and it scared the freaking hell out of people. And I think some people are still scared and still think those numbers, but here in this number, we're looking at 0.26% of people who are exposed end up, that are have COVID or have the virus end up dying. When they broke it out into the age groups, this is something that's important because our youth have a strangely disproportionate idea of how at risk they are, but their fatality risk in the under 40s was 0.01. That's really freaking low. And but again, 0.01%. In the over 60 age group, that jumped up to 1.71%, which is arguably higher than what we see with seasonal influenza, which usually has a tendency to hang out around 0.8. However, many people have certainly referred to the numbers of COVID as being a really bad flu, and that those numbers, those estimates are not too far off. So again, looking at age groups, the under 40, I mean, that's a pretty, the risk of dying from that is really low. And keep in mind, these people all have comorbidities. If we then looked at healthy people who are healthy, truly healthy, that number would be even lower, and we'd need to start using scientific notation to talk about how at risk those people are. So as always, I'll post a link to this particular study it's in the Annals of Internal Medicine, and I look at these numbers also if we could consider the exposed people, not just people who are diagnosed positive or had antibodies, these numbers would drop down even lower. And that's the reality of what we need to look at, that COVID has been scary based on its broad approach. But when we look at it from a numbers standpoint, which we have to do when we're making decisions on other people's lives and statistics and economy, we really have to look at the big pictures and look at this from a statistical standpoint, that those numbers just continue to fall. As always, make sure you like this video, share it with somebody who you think needs this information, and remember to subscribe to the channel.